Due to the COVID-19 pandemic, the world stops. But not the determination of others to be a registered professional. Welcome to our online quiz.
Hello nurses and hello midwives, welcome back to my YouTube channel. So our topic for today is all about your mastitis. At kung bago ka lamang sa aking channel, don't forget to like, comment, and subscribe, and click the bell button for more video updates. So let's begin our topic with your mastitis. Okay, so if we say mastitis, mastitis is also known as the breast fever. Okay, so breast fever is the other name for mastitis. So mastitis is the inflammation of the breast that can be infective or non-infective. So mastitis is an infection of the lactating breast, and it occurs most often during the second and the third weeks after birth. So dito pa lang sa ating onset of your breast condition, malalaman na po natin kung ang problem po natin is breast engorgement or your mastitis. Kasi take note, breast engorgement occurs within the first week after your delivery, and mastitis occurs at the 2 to 3 weeks postpartum, or common po yan second to third week postpartum. Unlike kay breast engorgement na nasa first week ka pa lang ng postpartum period mo, meron na po tayo dyang fullness of the breast. Pero kapag ang problem natin like your tenderness and the redness of your breast is nakita mo 2 to 3 weeks postpartum, usually ang problem na po natin dyan is your mastitis. Remember also nurses and midwives that mastitis is more common in mothers nursing for the first time, and take note that it usually affects one breast. So mas common po ang mastitis sa ating mga primary-gravid mothers na nagbre-breastfeeding. So tandaan po natin midwives and nurses na sabi ko nga kanina, there are two types of your mastitis. We have your infective mastitis and the non-infective mastitis. So we have your two types, the non-infectious type and the infectious type of your mastitis. Pag sinabi po nating non-infectious type or your non-infective type of your mastitis, the usual cause here is the milk stasis or yung pagbara ng gatas sa milk ducts ni nanay. At pag sinabi naman po nating infectious type or the infective type of your mastitis, usual microorganism here is your Staphylococcus aureus bacteria. Again, the causative agent that causes your infectious type of your mastitis is the Staphylococcus aureus bacteria. Then next, let's talk about your risk factors causing your mastitis. So in your risk factors for mastitis, we have here your mnemonics mastitis. For letter M, we have your milk stasis. So if we say milk stasis, the milk ducts that carries milk from the breast are obstructed or blocked. Okay? So pag meron po ditong namuong mga gatas at nag-cause po yan ng pagbabara, causing milk build-ups within the breast and causes the inflammation, and it may result in infection known as the mastitis. So kapag meron po tayong baradong milk ducts, pwede pong yung mga gatas na namuo doon is mag-cause ng inflammation sa ating breast glands, at yun yung mag-cause ng ating mastitis. Okay? For letter A, we have your age of your patient older than 30 years old. So if the woman's age is 30 years old and above, so that is a risk factor for mastitis. And for letter S, we have your sore cracked nipples. So take note that your Staphylococcus aureus bacteria are normally found in the skin, and if this bacteria enters the breast tissue, it causes your mastitis. So kapag meron po tayong sore cracked nipples, yung ating sore cracked nipples ay magiging entry point po yan ng ating Staphylococcus aureus para i-infect po niya yung mga breast tissue causing your mastitis. And for letter T, we have your trauma to nipples. Okay, so nagkakaroon ng trauma sa nipples. So kapag meron po tayong trauma sa nipples, nagkukos po yan ng sore cracked nipples. At sabi ko kanina, kapag may sore cracked nipples, yan na po yung magiging entry point ng ating Staphylococcus aureus bacteria. And letter I, improper latching on. So nakadepende din po yan sa ating positioning and your proper latching on. So pwede rin kasi yan na mag-cause ng ating mastitis kapag hindi po proper yung latching on or attachment ni baby. So mamaya mapag-usapan po natin yung ating proper latching on. The next we have also letter T, tight breast. Okay? So kapag meron po tayong mga tight breast or mga underwears na nilalagay ni nanay sa kanyang breast, okay? Tight breast can also cause your mastitis kasi ini-impede po niya yung ating milk flow. Then letter I, we have also your intrinsic factor like your primary parity. So Common dito na nagkakaroon ng mga mastitis yung mga primary or gravid mothers na nagbre-breastfeeding, okay? So, primary is also a risk factor for your mastitis. And letter S, we have your short frenulum in infant. So, remember nurses that short frenulum can also increase the risk of mastitis kasi nagkakaroon po tayo dito ng difficulty of your sucking of your newborn to the breast, causing your sore, cracked nipples. Again, for your risk factors for mastitis, we have your mnemonics, we have your mastitis. So, we have your milk stasis, age older than 30 years old, sore cracked nipples, trauma to nipples, improper latching on, tight bras, intrinsic factor like your primary and your short frenulum in infants. Then next, after ng ating risk factors for your mastitis, we have also your signs and symptoms of your mastitis. So, for our mnemonics for the signs and symptoms of your mastitis, we have your infected mnemonics, okay? So, we have your letter I, we have your inflamed breast. Okay, inflamed yung breast mo dito. So, the breast signs and symptoms includes your pain, redness, and a lump, or swelling, or being hot to touch. So, tandaan niyo po yan. So, inflamed yung breast mo sa ating mastitis. Then, next, we have also your letter N, nursing discomforts like your painful breast. Okay, so, painful breast during your nursing or breastfeeding. Then next, for letter F, we have your flu-like signs and symptoms. So take note, yung mga flu-like signs and symptoms sa ating mastitis, it is also known as the systemic symptoms of your mastitis. So pag sinabi nating systemic symptoms of your mastitis, these are the flu-like signs and symptoms like your fever, chills, aching, and headache. Okay, so meron din po tayong headache sa ating mastitis, and that is your flu-like signs and symptoms of your mastitis. Then next, we have also letter E, elevated temperature or the fever for mastitis. So take note that temperature in mastitis is higher than 38 degrees Celsius or higher than 101 degrees Fahrenheit. Okay? So remember that fever is one of the classic sign of infection. So fever is present into mastitis. Then next, we have also letter C. Letter C is continuous burning sensation or hot to touch. Being hot to touch is also a sign of mastitis. Then, letter T, we have your tender and swollen. Okay, tender and swollen breast. So, meron din tayo dito makikita mga lumps or hard mass and reddened area. So, yung letter E, that is your erythema or redness. Okay, so pag namumula-mula, that is a sign of your inflammation and infection. The next, letter D, we have your discharges and the presence of your pus. Okay, so pag meron na po tayong nana, it requires your incision and drainage procedure. Again, for the signs and symptoms of your mastitis, we have your mnemonics, infected mnemonics. I for inflamed breast, N for nursing discomforts like your painful breastfeeding, F for your flu-like signs and symptoms like your fever and chills, E for elevated temperature or fever, and C for the continuous burning sensation or being hot to touch, and letter T, tender and swollen breast, and letter E, erythema and redness into that area, and letter D, discharge of pus. Okay, so yun po yung ating mnemonics for your signs and symptoms of your mastitis. We have your infected mnemonics. Then next, for our management or treatment for your mastitis, we have your mnemonics here, the A, B, C, D, E, F mnemonics. So we have your A for the alternating warm and cold compress, and B, breastfeed on demand every 2 to 3 hours. So take note, nurses and midwives, never restrict and never stop breastfeeding in case of mastitis. So always continue breastfeeding and feed on demand every 2 to 3 hours in a day and every 4 to 6 hours at night naman po yan. Then for letter C, correct position and latching on. So take note, correct positioning and latching on can prevent and can also manage your mastitis. Kasi take note, isa po yan sa mga dahilan kung bakit nagkakaroon po tayo ng mastitis, gawan ng nagkakaroon tayo ng sore, cracked nipples due to your improper latching on. Then next, for letter D, do not use soap in the breast. So bawal pong gamitan ng sabon ang breast kapag i-cleanse natin. So only use water. So use only water for cleansing of your breast. So never use alcohol and do not use soap in cleaning your breast. Okay? So bawal gumamit ng sabon at saka alcohol to cleanse your breast because these can promote dryness into your breast. And kapag nag-dry yung breast mo, it causes your sore, cracked nipples at magiging entry point po yan ng ating bacteria. Then next, for letter E, manually express your milk or use your breast pump and then massage your breast. So again, pwede po nating i-express yung milk via manual expression and breast pump, then massage your breast to prevent your milk stasis causing your mastitis. Then, for letter F, we have your free the breast to air. So, after breastfeeding, you can manually express some milk or pwede na rin po yung ating colostrum to act as a natural lubricant. Then, expose your breast to air to prevent dryness. So, tandaan nyo po yan. You can manually express your milk to act as a lubricant to your breast to prevent dryness. Then next, itry na nating sagutan yung mga common board questions pagdating kay mastitis. Okay, so ito po yung mga lumalabas na tanong sa ating board exam about your mastitis. Okay, so situation, Vivian is a 2-week postpartum mother seen in the health center. So on further assessment, Nurse Edison noted a localized redness on the left breast and the mother is diagnosed with mastitis. So question number 1, which additional finding confirms the diagnosis that the patient has mastitis? A. Enlarged glands in the axilla. B. Normal temperature. C. Engorged breast. Or D. Hard mass and reddened area. Okay, so alisin natin dito yung ating letter B. So eliminate letter B kasi normal temperature is not a sign of your mastitis. Kasi in your mastitis, there is a fever or an elevated temperature. So mali po ang ating letter B. So, for letter A, letter C, and letter D, possible po yan na magkaroon yan sa ating mastitis. But, which of the following will confirm the diagnosis that the patient has mastitis? So, the correct answer here for question number 1 is letter D, the presence of your hard mass and reddened area. So, the breast symptoms of your mastitis includes your pain, redness, a lump or a mass, or a swelling, or being hot to touch. So, yun po yung mga signs and symptoms ng ating mastitis. So, letter D is the correct answer. A hard mass and reddened area will confirm the diagnosis that the patient has mastitis. Kasi yung letter C natin, engorged breast can be a sign of engorgement. Okay, so although na pwede rin ma-engorge yung breast ng mastitis, but engorged breast is more common in your breast engorgement. Then next, for question number 2, Vivian asked the nurse the cause of this ailment. So which of the following would the nurse explain as the predisposing factors for mastitis? Select all that apply. So 1, milk stasis. 2, nipple trauma. 3, using alcohol in cleaning nipples. Or 4, baby's sitting position. So A, 2 and 4, B, 1 and 4, C, 1 and 2, or D, 2 and 3. Okay, so alin daw dito yung ating predisposing factors for your mastitis? So, sabi natin, one of the predisposing factor for mastitis is your milk stasis. So, pasok na yung ating option number 1. So, tanggalin na natin yung mga walang option number 1. So, eliminate letter A, eliminate your letter D. So, B or C na lang ang natitira. So, number 2, nipple trauma. So, nipple trauma can be a predisposing factor also for mastitis. So, pag nagkaroon ka dito ng ating sore crack nipples, so pwede po yan na maging entry point ng ating Staphylococcus aureus infecting your breast gland causing your mastitis. So, pasok na rin po yung ating option number 2. So, the correct answer for your number 2 is letter C, 1 and 2. Okay, so 1 and 2 are the predisposing factors for mastitis, milk stasis, and your nipple trauma. So, although yung ating number 3, using alcohol in cleaning nipples can also cause your mastitis because of your dryness of your nipples, so hindi pa po yan yung ating pinaka-predisposing factor for mastitis. Kasi mas predisposed po yan sa ating sore crack nipples. Okay? Then next, for question number 3, Vivian complains of unbearable pain. Which of the following characteristics are emphasized in a culturally sensitive nursing care? So, select all that apply. So, option number 1, the expression of pain is affected by learned behavior. Option number 2, physiologically, all individuals experiences pain in similar manner. Option number 3, some Asian people has high response to pain medication. Or option number 4, patients should be assessed for pain regardless of overt symptomatology. Okay, so alin dito daw yung ating i-emphasize for a culturally sensitive nursing care? A, 3 and 4, B, 1 and 2, C, 1 and 3, or D, 2 and 3. So, mag-eliminate muna tayo dito ng ating option. So, eliminate our option number 2. Okay, bakit option number 2 yung ating tatanggalin na una? Okay, so option number 2 is eliminated kasi sabi dito, physiologically, all individuals experience pain in similar manner. Okay, so take note that physiologically, not all individuals, even those of the same ethnic culture, will respond in a similar manner. So, hindi po yan. So, mali po ang ating number 2 kasi from the word all, mali na po yun. Obsolete word na po yan pagdating sa board exam. So, eliminated na po yan agad. So, actually, based on our Perry and Potter Fundamentals of Nursing 7th edition, page 1059 to 1060, the correct answer here is 1, 3, and 4. Okay, so yung nga lang, wala po tayong combination of 1, 3, and 4. Kasi sabi sa ating Perry and Potter book na Fundamentals of Nursing 2009 7th edition, page 1059 to 1060, ang sagot doon is 1, 3, and 4. So, the expression of pain is affected by learned behaviors daw. Correct po yun. Then, yung number 3 natin, yung ating some Asian people has high response to pain medication. Pasok din po yan. Kasi nga, sabi doon is ethnic culture has an effect on the physiological response to pain medication. So, yung ating number 4 kasi, tama din po yan sana. Kaso nga lang, ang nakalagay po dyan is, patients should be assessed for pain regardless of overt symptomatology. Pero yung nasa book ni Perry and Potter, ang nakalagay doon sa ating option number 4 is, client should be assessed for pain regardless of a lack of overt symptomatology. So, nandoon kasi yung word na lack of overt symptomatology, which is dito sa ating option number 4 dito, patient should be assessed for pain regardless of overt symptomatology lang. Wala yung word na lack of overt symptomatology. So, the correct answer here is 1 and 3. The expression of pain is affected by learned behavior and some Asian people has high response to pain medication. So, the correct answer and the safest answer here is letter C, 1 and 3. Then next, for question number 4, Nurse Edison provides instructions about measures to prevent postpartum mastitis who is breastfeeding her newborn. Which of the following would indicate that the mother needs further instruction? So, I should blank. So, needs further instruction. So, ibig sabihin po niyan, mali po yung ating sinabi kapag needs further instruction. So, mali ang sinabi ni nanay kapag it needs further instruction. So, kapag merong mastitis si nanay, kailangan letter A, wash my hands well before breastfeeding. So, tama po yun. So, hindi po niya need ng further instruction kasi tama yung gagawin mo kapag i-wash mo yung hands mo before breastfeeding. Letter B, breastfeed every 2 to 3 hours. So, tama rin po yan. So, you must breastfeed on demand and every 2 to 3 hours in a day and every 4 to 6 hours at night naman. So, tama rin po yan. Okay? So, nasa Saunders po yan. So, letter C, change the breast pads frequently. Yes, para mawala po yung ating moisture doon at hindi mapunta sa breast, causing your sore crack nipples kapag nababad sa pawis. So, letter C, tama din po yan. So, letter D, wash my nipples with soap and water prior to feeding. That is the correct answer kasi the mother here needs further instruction kasi nga bawal pong gamitan ng sabon ang nipples or breast ni nanay prior to feeding kasi ang sabon ay nakakadry ng breast. Okay, so letter D is the correct answer. So the mother needs further instruction if the mother said, I will wash my nipples with soap and water prior to feeding. So letter D is the correct answer here. Then next, for our last common board question, number 5, considering her level of knowledge and anxiety of her condition, patient Vivian raised questions on possible ways of relieving her breast discomfort. So, which of the following statements needs further instructions? A, I have to stop breastfeeding until this condition resolves. B, I can take antibiotics and should begin to feel better in 24 to 48 hours. Or letter C, I can use analgesic to assist in alleviating some of these discomforts. Or letter D, I have to wear a supportive bra to relieve the discomfort. So again, so the question here needs further instructions. So ibig sabihin niya, negative na naman ang sinabi ni patient Vivian. Okay? So for your question number 5, the patient that needs further instruction here, the statement of the patient that needs further instruction here is letter A. Why? Kasi sabi dito, I have to stop breastfeeding until this condition resolves. Okay? So take note, nurses, that in most cases, the mother can continue to breastfeed with both breasts. Okay? So if the affected breast is too sore, the mother can pump the breast gently. So take note that regular emptying of the breast is important to prevent abscess formation. So yung ating letter B naman, tama din po yan kasi antibiotic therapy assists in resolving the mastitis within 24 to 48 hours. And also letter C, tama po yan na gumamit ng analgesic to relieve and to alleviate your discomforts during your breastfeeding. So, additional supportive measures include your ice packs, breast supports, and your analgesics in cases of your mastitis. So, for your question number 5, the correct answer here is letter A.